Hello everybody, my name is Christopher Little and I am a final year medical student at Imperial College. Today I'm going to be doing a short presentation on Hodgkin's lymphoma. So by the end of this video, it is my hope that you will be able to identify the key presenting complaints of a patient with Hodgkin's lymphoma. You'll be able to understand the modalities used to diagnose Hodgkin's lymphoma. You'll be able to stage the disease, and you'll also know the important complications of the disease and its treatment. So to start, we have a short case vignette, and this is of a 77-year-old male with a 3-month history of fatigue, fever, weight loss and night sweats. He also mentions to you that he no longer drinks alcohol as he has periods of neck pain after drinking. The other important past medical history to note is that he did have glandular fever as a child. On examination, you notice a lump in the front of his neck, which you believe to be in keeping with cervical lymphadenopathy, and upon examination of the abdomen, you are able to palpate the liver approximately 4 to 5 centimeters below the costal margin. You then perform a full blood count and find that he is mildly anemic with a hemoglobin of 102 grams per litre, but with a normal mean cell volume and mean cell hemoglobin concentration. You also find a raised white cell count consisting predominantly of lymphocytes, but note that the neutrophils and eosinophils are also raised. Given his symptoms, you then also perform a chest X-ray and find an abnormal mass within the mediastinum. A biopsy from the enlarged cervical lymph node is taken, and you are able to identify an abnormal looking cell seen here on the left hand side. When you look at the overall structure of the lymph node, you are also able to identify a nodular pattern with interwoven sclerotic tissue. We will now discuss this case with the help of some questions. Please pause the video after each question to allow yourself time to think about the answers before proceeding. We will begin by asking why Hodgkin's lymphoma is the most likely diagnosis in this patient. So if we first consider his presenting complaint and features upon examination, you will remember that the patient had lymphadenopathy. Now in Hodgkin's lymphoma, this is typically of the cervical or mediastinal lymph nodes, and that these lymph nodes become painful upon consuming alcohol. These symptoms may or may not also be accompanied by the B symptoms, which are fever, night sweats and weight loss, which this patient had. He also had a history of glandular fever, which is caused by the Epstein-Barr virus. Now the Epstein-Barr virus is also a risk factor for Hodgkin's lymphoma, and approximately 40% of cases have traceable EBV on their samples. His white cell count was raised, and it was predominantly lymphocytes, and his X-ray showed a mediastinal mass, which will represent those mediastinal lymphadenopathy. If we then consider his cytology and histology, he had those abnormal binucleated cells which are called Reed-Sternberg cells. Now these are characteristic of Hodgkin's lymphoma, but it's also important to note that they can occur in some other conditions. And in terms of the structure of his lymph node, it had that nodular sclerosing pattern, which is the most common form of Hodgkin's lymphoma. If we then consider their age on the next slide. As you can see from this graph, Hodgkin's lymphoma has a bimodal distribution with a first peak in adolescence and early adulthood and a second peak above the age of 70. Now this graph was taken from Cancer Research UK and thus is fairly typical of a developed Western country. It is, however, important to note that in the developing world, the peak around adolescence and early adulthood is a lot greater, due to the association of Hodgkin's lymphoma with EBV and the greater prevalence of immunosuppression in these countries. We will now discuss what further investigations you would like to order in order to confirm a diagnosis of Hodgkin's lymphoma and stage the disease. The first investigation would be flow cytometry to identify the cluster differentiation markers. Cluster differentiation markers, put simply, are cell surface molecules the combination of which are unique to different cell types and can be used to identify cells. Hodgkin's lymphoma will typically be positive for CD15, 30 and 138 and negative for mature B-cell markers such as CD20 and surface IG. Please also note that 5% of Hodgkin's lymphoma is non-classical and is the reverse, being CD15, 30 and 138 negative and CD20 positive. In addition, you would also want a PET-CT to stage the disease. This brings us nicely on to our next discussion point in asking what stage of disease this patient has. For the staging of lymphoma, the diaphragm is an important anatomical landmark. If you have disease in one lymph node area on one side of the diaphragm, you have stage 1 disease, and if that spreads to 2 areas of lymph nodes, then that's stage 2. If you then have lymph nodes affected on either side of the diaphragm, you have stage 3 disease, and if this further spreads to include structures such as the liver or the pelvis, which are extra lymphoid tissue, you have stage 4 disease. It's important to understand that for the purpose of staging, the spleen is counted as a lymph node. The staging of lymphoma is then further classified depending on the presence or absence of the B symptoms we mentioned earlier. If we now consider the patient in the case history, he had cervical, mediastinal lymph nodes, and he also had an enlarged liver. Therefore, because there's disease on either side of the diaphragm and involving extra lymphoid tissue, he had stage 4 disease, and due to the presence of fever, night sweats and weight loss, he would have stage 4B Hodgkin's lymphoma. Following the diagnosis of Hodgkin's lymphoma, it is also important to understand what treatment options are available and what the general principles of treatment are. Unless there is a contraindication, treatment begins with combination chemotherapy to reduce the size of the lymph nodes. Now, there are 2 common regimes used. The first is ABVD, consisting of doxorubicin, bleomycin, vincristine and dacarbazine. The second regime, BCOP, is used for higher risk cases, as for these patients it has a better remission rate than ABVD. Following the chemotherapy, the patient then receives targeted radiotherapy to further increase the rates of remission. Finally, as with any condition, it's important to understand the complications of both the disease and its treatment. If we first look at the complications of the disease itself, the major one relates to the non-functioning B cells, leading to the reactivation of viral infections and conditions such as shingles and recurrent and/or serious sinopulmonary infections. Patients with mediastinal masses are also at risk of obstructing surrounding structures, namely the trachea, esophagus, and superior vena cava. If we then consider the iatrogenic harm from the chemotherapy regimes, you have doxorubicin, which mainly has cardiac toxicity, bleomycin, causing lung fibrosis, dacarbazine, which can cause bone marrow suppression and cytopenias, and vincristine, which causes peripheral neuropathy. Finally, when we consider the long-term outcomes of these patients, the biggest risk in the first 15 years is relapse of disease. Beyond this, the risk is related to the iatrogenic harm of the chemotherapy and radiotherapy, namely secondary malignancies in the 15 to 20 year period and cardiorespiratory disease in the 20+ year period. To consolidate the key learning points from this lecture, I've written 4 VSAs. Please now pause the video to give yourself time to answer the questions before moving on. So in respect to the lymphadenopathy and alcohol consumption, the latter typically results in pain. In terms of the B symptoms, these consist of fever, weight loss, and night sweats. The cell, which is commonly associated with Hodgkin's lymphoma, is the Reed-Sternberg cell. And finally, the anatomical structure which helps stage lymphomas is the diaphragm. In summary, Hodgkin's lymphoma has a bimodal distribution, with patients presenting in early adolescence and adulthood, and later in those over 70. They have lymphadenopathy, which may become painful upon alcohol consumption, plus or minus the B symptoms of fever, weight loss, and night sweats. The basic and key investigations to diagnose and stage the disease are a full blood count, lymph node biopsy, flow cytometry for the cluster of differentiation markers, and a PET-CT. The complications experienced by said patients relate to the recurrent or reactivation of viral infections, disease relapse, secondary malignancy, and cardiorespiratory disease. And that concludes this talk on Hodgkin's lymphoma. I'd like to thank you all for taking the time to watch this video, and hope you are now in a better place to understand Hodgkin's lymphoma. Finally, I'd like to say goodbye by wishing you all the best for your upcoming exams and your future careers in the medical profession.